Radiological anatomy of thorax, which is commonly known as X-ray chest. When you're reading out an X-ray during your viva, you have to keep in mind the following points. You have to talk about the region to which the radiograph belongs. For example, if it is of the shoulder region, you have to say that it is of the shoulder region. Then you have to talk about the view to which it belongs. If it is the antero-posterior view, whether it is the posterior-anterior view, PA view, or if it is a lateral view, or the skyline view, or the oblique. Then you have to say whether it is a special X-ray or if it's a plain X-ray. A plain radiograph is the one in which no special dye is used, but in a special X-ray they use special dyes. Then you have to point out the bones that are visible in the radiograph in front of you. You have to also name the joints that are visible, and then you may talk about the clinical applications. This is X-ray chest. It is of the plain type. It is a plain radiograph because no dye, special dye is used. And it is of the posterior-anterior view, that is the PA view, which means the X-rays travel from the posterior to the anterior side. Most of the chest X-rays are taken in the PA view because in the PA view, anteriorly placed organs are better visualized, and in thorax, all important structures are placed anteriorly. So if there's an X-ray of the chest region, then it's mostly of the PA view. In the radiograph, the bones appear white in color and they give radio opaque shadows, whereas the dark shadows that are seen are of the lungs, the trachea in the midline, and also the gas in the fundic region of the stomach below the diaphragm. This is because it is filled with air and hence it appears dark or radiolucent. Bones visible. The two clavicles are quite visible. You can see the scapula, you can see the sternum, and you can see the ribs. The posterior parts of the ribs are better visible than the anterior parts because the posterior parts of ribs contain more amount of calcium. The costotransverse joints are seen on each side, and the bones of the vertebrae are partially visible. Check for the costodiaphragmatic recess and the costomediastinal recess. The costodiaphragmatic recess is present more laterally between the lungs and the diaphragm, and the costomediastinal recess is present more medially between the lungs and the heart. What are costophrenic angles? The angles where the diaphragm meets the thoracic cage are known as costophrenic angles. There is a right costophrenic angle and a left costophrenic angle. The costophrenic angle appears as a white shadow, that is, it gets obliterated in case of pleural effusion because the fluid gets filled in the costodiaphragmatic recess. The lung is divided into 3 zones. The upper zone is from the apex of the lung till the level of the second costal cartilage. The middle zone is from the second costal cartilage to the fourth costal cartilage. And the lower zone extends from the fourth costal cartilage till the base of the lung. The shadow of the heart is prominently seen. The right border of heart is seen and the left border of heart is also seen. On the upper side of the left border of the heart, you can see the shadow of the arch of aorta. The shadow of arch of aorta is known as aortic knuckle. The right border of mediastinal shadow from above downwards comprises the right brachiocephalic vein, the SVC, the right atrium, and the IVC. Whereas the left border of mediastinal shadow from above downwards contains the aortic arch, that is the aortic knuckle, then the pulmonary trunk, left auricle, and left ventricle. Cardiothoracic ratio is equal to the distance between the two ends of the heart divided by the distance between the two ends of the thorax. In normal conditions, the cardiothoracic ratio is 1:2, which means The transverse diameter of the normal sized heart is always half of the transverse diameter of the thoracic cage. But in case of cardiomegaly, the cardiothoracic ratio gets disturbed.